to make a difference, to increase impact, we need to come together, we need to collaborate, we need to collate the data and experiences that we have.
There's not enough attention being paid to children's suicides. I don't know how many of you are aware, but more than 10,000 children die by suicide each year. When I mean children, these are kids under the age of 18 years. While we talk about other areas of suicide, we talk about farmers' suicide, women's suicide, we talk about suicides of students at universities, I think children are a really forgotten metric.
There is no single reason for suicide. There are a variety of reasons. So if you want to bring down the suicides in young people, we have to look at the education system, the family system, the socio-economic system, and also build the individual resilience. We also have to address the issues emanating from social media and help the children to cope with real problems in a more effective way.
It was a very good intervention which has been planned, and whatever comes out of it, there will be many more discussions which are going to take place. There will be more interaction with young people to understand what is it which is stressing them out, what are the mental health issues they are facing, and how can we as policymakers, we as community workers, we as healthcare providers, what we can do to make their lives much safer, much healthier and more comfortable.
There is already data to show some interventions in terms of what works and what doesn't work. And if there is a way for us to actually double down on that and take it to stakeholder groups beyond just the health and mental health ecosystem, but really working on a diverse set of topics, I think that will be great.
Especially when it's about children, I make a personal commitment to stand behind this campaign. Having built multiple campaigns have power to shift narratives.
Priority area that I'm taking away is just destigmatization of suicides and just conversations around suicide, and how we can make that more of a public dialogue is something that I'm hoping to be able to figure out how to work on.
Around the issue of child suicide, something which is very difficult to talk about for everyone, including the stakeholders, but also for the policymakers. And to understand that suicide prevention or reduction is not just a mental health issue, but also a social issue that needs all the partners, stakeholders, and people from the society to come together.
It was wonderful to interact with a lot of organizations and individuals who are very sensitive about this issue. We had some experts who gave us a lot of inputs as to what are the different policies and strategies of the government to handle mental health. We all realize that a lot remains to be done in this sector.
I think I was deeply moved by the personal experience that was shared. I'm a parent too, and I can only imagine the devastation of having one of your children die by suicide. So I think it becomes a very personal and a professional thing for me to be engaged in, and I think the workshop really brought that home.
This was really eye-opening in terms of seeing how layered suicide is as an issue and how this is going to take years to work on, but it is a problem that is emerging and urgent, and more of us need to come together to have dialogues and then think of how are we going to make this happen.
CMHRP, that is the Center for Mental Health Law and Policy, and Quicksand kind of came together to build this initiative to try and address and reduce child and adolescent suicide from 10,000 to 0. So we've been trying to bring together a diverse set of people to foster intersectoral collaboration. So we've gotten researchers, we've gotten policymakers, we've gotten funders, we've gotten people with lived experience to come together to develop a shared understanding.
One key takeaway from the last 2 days has been how important it is to approach child suicide from multiple perspectives and really look at it from the influence of the family environment, the school environment, the environment of the broader ecosystem and structural determinants. And thankfully we have in the room, we have people who have really understood this issue from multiple perspectives. And so it's been really illuminating to come together and work on this and everyone bring in their own understanding and their own knowledge and deep expertise. And so I think in doing that, we've really been able to distill maybe some of the key priorities, at least for this group.
We started by just introducing all of ourselves, and I think getting to hear from each and every person what they did and specifically why they were here was really interesting.
The space of mental health as well as the niche area of suicide prevention is very close to me personally, and to really gain that knowledge which will help me to go back and have these conversations with funders in my journey through funder advisory work, because now I'm going back with the perspectives of so many different stakeholders who are representing so many different roles in the sector.
It's just very heartening to see so many people in this space care about something that is so close to my heart, about child suicide and how we can prevent it. And the amazing amount of work that is being done in diverse areas has been wonderful to hear about.